The prostate is a tiny organ, but when it gets sick, it can turn a man's life into a real nightmare. Nighttime trips to the bathroom, a weak stream, the feeling of incomplete emptying of the bladder. These are just some of the symptoms that gradually chip away at a man's sense of strength. Many mistakenly take this as a natural part of aging, not realizing it's a signal that the prostate needs help. Fortunately, there are simple, natural, and effective ways to protect this important organ. In a study conducted by scientists at the University of Helsinki, without resorting to expensive drugs, surgery, or other medical interventions, data from more than 12,000 men over 60 were analyzed. The results showed that men who used natural and preventive methods had a lower risk of inflammation, hyperplasia, and urinary disturbances, even without taking medication. The publication of the study in the Scandinavian Journal of Urology confirms what medicine has long known. Active attention to one's health, especially prostate health, has a positive effect on a man. I am Dr. Eduardo Vasconcelos, a urologist with more than 40 years of experience. Today, I want to share 5 golden rules that will help keep the prostate strong, healthy, and protected from inflammation, abnormal growth, and serious disease. If you're over 60, this video is for you. It could be a starting point for a new stage of life, full of control, health, and confidence. Let's get to the point. Write your age and region in the comments, so we can bring this content to even more men like you. Together, we will improve your men's health through a sensible approach and prevention. The first step is a golden habit, fully emptying the bladder and prostate every day. Few talk about this, but after 60, the buildup of residual contents in the bladder and pelvic organs can trigger a chain of dangerous consequences: inflammation, infections, abnormal tissue growth, and even impotence. Rushing urination without patience, or going long stretches without ejaculation, creates conditions of stagnation in the body. Stagnation in the bladder or prostate creates a favorable environment for infection, since residual urine and old secretions serve as a nutrient medium for bacteria. They lead to thickening of prostatic fluid and increased pressure on internal tissues. That's why the first important habit that can substantially improve health is simple. Urinate calmly, preferably sitting, and maintain regular sexual activity, even if solo. A study published in the International Journal of Neurourology showed that older men who prefer to urinate while seated achieve more complete bladder emptying, better urine flow, and fewer residuals, which in turn reduces symptoms of benign prostatic hyperplasia. Another study conducted by Harvard Medical School that followed more than 30,000 men for nearly 20 years found that in men who regularly ejaculated, the risk of developing prostate cancer decreased by 33%. In essence, emptying the body is not just a matter of personal comfort, but an important step in prevention. It is a natural cleansing process. Care for the foundation of your male health. Pay attention to the act of urination. Don't rush. Let everything pass. Keep the prostate active and avoid stagnation and inflammation. This is a simple, evidence-based, and effective solution. The second important habit is to limit red meat and dairy products that promote inflammation. Your diet has a direct impact on the condition of the prostate. Few men know that some traditional foods, such as red meat and dairy, can provoke inflammation of this gland. After 60, the body no longer absorbs saturated fats as efficiently as in youth. Metabolism slows, the digestive system becomes more sensitive, and the ability to handle excess animal protein and heavy fats decreases. The result is an internal environment more prone to chronic inflammation, and the prostate feels this directly. A study published in the American Journal of Clinical Nutrition followed more than 15,000 men for 8 years and showed that high consumption of red meat is associated with increased risk of benign prostatic hyperplasia and with higher PSA levels, a classic marker of prostate inflammation and growth. Another Harvard study showed that excess calcium from dairy products such as whole milk, yellow cheeses, and regular yogurts can also contribute to the progression of prostate diseases, including early-stage cancer. Why does this happen? Because both red meat and high-fat dairy raise levels of IGF-1, a growth factor that can stimulate abnormal cell proliferation in the prostate. In addition, these foods can provoke oxidative and inflammatory reactions in the body. However, This is no reason for radical steps. The key to healthy eating is moderation and sensible substitution. Try reducing red meat during the week. Prioritize fatty fish, sardines, salmon, or mackerel, rich in omega-3s with proven anti-inflammatory effects. Instead of fatty cheeses, choose small portions of mild white cheeses and include cruciferous vegetables more often: broccoli, cabbage, and arugula. They have protective effects on prostate tissue. Thanks to such small changes, you lower inflammation in the body, giving the prostate a chance to breathe, shrink, and function more harmoniously. This seemingly minor habit can spark a real revolution deep in your metabolism. With age, after 60, masculinity shouldn't get in the way of effectiveness. Instead of sticking to the traditional approach and urinating standing up, it is recommended to do so sitting whenever possible. A tense posture and contracted muscles while urinating standing can prevent full bladder emptying. Residual urine, even in small amounts, creates pressure on the prostate, which can lead to infections, inflammation, and discomfort during urination. Medicine has long known this, but few men have been properly informed. A study published in PLOS One that analyzed 11 clinical works with more than 800 men concluded that urinating while seated improves urine flow and reduces residual volume, especially in men with lower urinary tract symptoms, such as those seen in benign prostatic hyperplasia. Put simply, when a person sits, the body relaxes, the perineal and pelvic muscles loosen, and emptying the bladder becomes easier. This is especially relevant at night, when the body is tired, the bladder is full, and the prostate is often slightly inflamed. Urinating while seated is a way to minimize effort, avoid subsequent discomfort, and help the body move more quickly into rest mode. This isn't about giving up your manhood. It's about a rational approach to physiology. Urinating sitting down is self-care. It's prevention disguised as simplicity. It's comfort that protects you after 60. Every decision that reduces the load on the prostate, however small it may seem, matters enormously for your quality of life. The fourth golden habit is a 15-minute walk after meals. It sounds simple, but walking after eating can be one of the most powerful habits for preserving prostate health. Science supports this. After 60, to maintain active circulation, normalize metabolic processes, and control inflammatory reactions, the body needs regular physical activity. After eating, digestion ramps up, insulin and glucose levels rise, and blood flow increases in the abdominal cavity. If a man lies down or stays still right after a meal, the accumulated energy isn't used efficiently, leading to increased inflammation, fat deposition in the abdominal area, and higher load on the pelvic region. However, if you get up and walk for just 15 minutes, the opposite occurs. Circulation improves, digestion speeds up, and more oxygen and nutrients reach the prostate. A study conducted at San Paulo University showed that men over 60 who regularly took light walks after meals had a lower likelihood of urological problems, reduced systemic inflammatory activity, and slower long-term progression of benign prostatic hyperplasia. This isn't about the gym or heavy workouts. It's enough to walk for a few minutes at an easy pace after lunch or dinner, preferably outdoors, preferably every day. This habit also helps control blood sugar, reduces oxidative stress, one of the enemies of the prostate, and improves sleep quality at night. A post-meal walk is like a natural medicine. It costs nothing, requires little effort, yet profoundly affects internal organs. Don't underestimate this simple act. It activates the body from within and can protect your prostate from the inside out for years. The fifth golden habit is to avoid drinking fluids after 6 p.m. to ease the prostate's workload and improve sleep. If you wake up several times at night to urinate, feel your bladder filling as soon as you lie down, or notice that your nighttime stream is weaker and uncomfortable, this may not be just aging. In fact, it could be a direct result of one simple habit: drinking too much fluid in the evening. After 60, nighttime urine production increases while the bladder's ability to hold large volumes decreases. In addition, if the prostate is enlarged or inflamed, it compresses the urethra and interferes with normal outflow. The result is classic. You get up once or twice or more per night, sleep poorly, lose energy, and start the day tired, irritable, and unmotivated. But this cycle can be broken with one simple measure. Reduce fluid intake after 6 p.m. Excess water in the evening overloads the bladder. And when the bladder is full, it puts pressure on the prostate, which is already sensitive due to age and chronic inflammation. This discomfort not only worsens urinary symptoms, but also degrades sleep quality and nighttime hormonal recovery. A study published in the Journal of Urology showed that men with benign prostatic hyperplasia who controlled their evening fluid intake experienced significant improvement in frequent urination, nocturia, and sleep disturbance. In other words, they sleep better and wake with more energy and less strain on the prostate. The recommendation is simple. Drink plenty of water during the day until 5 or 6 p.m. After that, gradually cut back and avoid tea, juice, soda, or coffee in the evening. Keep dinner light, without too many liquid dishes such as soups or broths. Your body will sleep more peacefully, your prostate will rest, and you'll wake more focused, energized, and in better control of your body. Bonus tip: include pumpkin seeds in your diet. Small, unassuming, but powerful. Pumpkin seeds are one of the best natural sources of zinc, a mineral essential for prostate health and testosterone production. They also contain phytosterols, plant compounds that help reduce prostate swelling and relieve symptoms such as weak stream, frequent urination, and the feeling of a full bladder. A study published in the Journal of Medicinal Food showed that daily consumption of pumpkin seeds significantly improved urinary symptoms in men with mild to moderate benign prostatic hyperplasia without side effects. The best part is they're easy to eat. Have 1 tablespoon a day, raw, roasted, or ground, adding them to yogurt, smoothies, or salads. This small daily act can provide your prostate with the right nutrients in the right dose, naturally, accessibly, and safely. Add them, try them, and watch how your body changes over time. In conclusion, prostate health remains one of the most neglected topics among men. Many suffer in silence out of shame, lack of information, or because they think it's normal for their age. But that is not true. You've seen that there are simple, natural, and effective methods for prevention, relief, and protection. These 5 key habits can make the difference between enjoying life to the fullest and spending the coming years in a constant loop of doctor visits, medications, and limitations. Therefore, if the information presented here was valuable to you, don't keep it to yourself. Share it with a friend, a relative, a father, someone who could truly benefit. Many men understand the importance of the problem only when they face its consequences themselves. But with clear, understandable, and reliable information, you can act in advance and prevent negative outcomes. Share this video with others. Perhaps you will be the one who helps change a life for the better. Take care of yourself. Until next time, and a big, strong hug.